Hello, my name is Aisha Brathwaite, and this is my public health presentation. I did my topic on Upper Darby's obesity issue. I did this because I'm someone who grew up in Upper Darby. I still live there. I graduated from there, and this is a public health issue that is personal to me in my town. So, what is obesity? Obesity is the condition of being grossly fat or overweight. Nationally, 1 in 6 children ages 2 to 19 are obese. And obesity can lead to many health problems, more than I have listed here, but the main 3 are diabetes, hypertension, and heart disease. And on the map here, it's a map of the United States, and basically the darker the color is, the higher the obesity rates. And as you can see, Pennsylvania is pretty red, so that's not really good for us. So this study here, I found it's a news clip, says childhood teen obesity 10 times higher than 40 years ago. And just gonna give you like the rundown of all the harm and like health risk of being obese.
The childhood obesity epidemic tops the Health Watch tonight. New research says it's now growing at an alarming rate.
Health reporter Stephanie Stahl is here with the new report, and this was just issued today. Steph?
That's right. This just came out, guys. You know, childhood obesity is an especially big problem right here in Philadelphia. This new study that looks at the global picture says being overweight when young has lasting effects. The number of obese children and teens is now 10 times higher than it was 40 years ago, according to the World Health Organization. It blames poor nutrition and lack of exercise, and the problem is more than just physical.
Social, psychological problems for the children themselves, more stigmatism, more bullying.
The study in The Lancet also says obese children tend to be overweight adults.
It's also more likely to lead to earlier onset of conditions like heart disease, cancer, and diabetes.
The research shows an estimated 74 million boys and 50 million girls are obese worldwide. Obesity rates are still rising in poorer nations, but have leveled off in countries like the UK and here in the United States. A mother of 2, Ruth Blackburn, tries to feed her 3-year-old organic foods and no refined sugar.
I limit the amount of meat that she has and find protein in other ways, like lots of seeds and fresh vegetables.
Health experts are trying to educate more parents like Ruth, as well as schools and governments, about the importance of balanced diets, proper food labeling, and the long-term impact of childhood obesity. Now, that research analyzed data from 2,400 different studies that tracked the height and weight of 32 million children between the ages of 5 to 19. So it's considered one of the most comprehensive reports we have to date on the picture of childhood obesity. The scary thing is these kids have really long-term impacts because the weight puts them at increased risk for so many things: heart disease, diabetes, etc.
Right, it's so dangerous.
Yeah, exactly.
All right, Steph, thanks.
Okay, yeah, so it's just talking about how teens today, especially more than teens from 40 years ago, are just becoming more and more unhealthy. And what I'm trying to do here is to find a way to tackle that for my own community in Upper Darby. This is just some stuff about Upper Darby, my community. It's located in Delaware County, has a population of over 80,000 people. It's pretty diverse, with 50% being white, 32% being black, 12% Asian, and 8% Hispanic. 20.6% are under the age of 20, 16% are in their 20s, 41% are in middle adulthood, so 30 to 60, and 17 are ages 60 and up. Our gatekeepers, so Nicholas Mikosi is our mayor, Daniel G. Norelli is our school superintendent, and James Maloney is the director of public health. This is just more about the community. We have 10 elementary schools, 2 middle schools, and 1 high school. Our grocery stores, which I will come back to later, we have 3 of them, which is Acme, Save-A-Lot, and Fresh Grocer. we had 26 recreational parks, though some of them are, they're not up to code. They're, I guess, under construction, you can say. But the ones I am more familiar with are Sellers and Nailers Run. We do have a senior center. We have a movie theater, a tower theater. We have a police department, fire department, and we also have a gym. And this is just a picture of Upper Darby High School. Like I said, this is the only high school in the district, which means a lot of the students go here. And this is just a very popular view of Upper Darby, and you can see downtown Philly there as well in the background. So the issue is that 30% of middle school and high school students in Delaware County are obese or overweight. The juniors and seniors at Upper Darby High no longer have to take PE due to budget cuts. This is actually something that happened, it was actually instated back in my junior year, which was like 6 years ago, and I called the school to see if that was still a thing, and it is. The juniors and seniors still, 6 years later, do not have to take PE because of budget cuts. Right outside the school, you will find multiple fast food options such as McDonald's, Dunkin' Donuts, Dairy Queen, 7-Eleven, and there's actually also a Perkins. So just to give some perspective, that's, half of the high school, the students there don't have to take gym, which means they're not getting exercise. And then on their way to school or going home from school, they're being bombarded by all these fast food restaurants. It's quite tempting. The grocery stores in the area are not known for having a large variety of all natural or organic foods, and they're not one of America's healthiest food stores. So what's the solution? I would bring up this issue with the mayor, director of public health, and the school superintendent at the town hall meeting. That's a picture of the town hall building, and they have meetings there pretty regularly. And I would work to develop a way to incorporate PE into the school curriculum without needing a significant budget. I do understand that to have a PE program, that's pretty expensive, but I think there's a way to do it without needing so much money. Because as you know, kids who are physically active do better academically. It's important for them to get physical exercise every day. And I think that having like an hour in between classes to just blow off some steam is just good for your mental state. So what I propose is that students will be required to record 3 hours of physical activity each week with evidence of the activity. And right here is kind of an example of what that log would look like. You have your date, what you did, how long you've done it for, the intensity, and a personal reflection. And I think 3 hours a week is fairly manageable, because if they were to be taking gym class in school, it will be 5 hours a week. So 3 hours it should be manageable. So even some more solutions. I would request healthier grocery stores to the area, such as Whole Foods and Aldi's. I'm sure if we bring up the issue at a town hall and get some petitions going, we can make this happen, because Upper Darby can already sustain 3 grocery stores. So what's one more? And these stores they have a large variety of products. They are known for being all natural, having non-GMO food, a lot of organics. So I think that's really good for the community to have some grocery stores that don't just sell processed foods. Also, to replace regular school vending machines with healthier ones, there's already, I guess, a law, you could say. The USDA says that schools cannot have vending machines that are not up to code, that have unhealthy foods in them. So this is a solution to that. These vending machines come from Human, which is helping unite mankind in nutrition. So they're 100% USDA compliant. Improves, the health and performance of the students. Gives them some healthy snacks in between classes and at lunch. And that's about it for my presentation. Let me know what you guys think of my solutions. Do you think they'll work? Do you have anything else that I could have tried instead? Just let me know. And then these are some of my references. Yeah. And that's about it. So again, my name is Aisha Brathwaite. Thank you guys for watching, and good luck on you guys' presentations. Bye-bye.